Hello, my name is Dr. Jeff Terrell from Handoff Solutions, and today I'd like to talk to you about marketing your institution or medical practice with our innovative software, MeAndMyDocs.com, a HIPAA-compliant, fast, and easy system for obtaining, reviewing, and archiving patients' radiology images. Before embarking on any marketing program, it's important to clearly establish the goal of your marketing. Many medical practices and medical centers have taken to the strategy of marketing their strongest programs that may draw from a wider geographic area. This destination program may be designed to build patient-driven referrals or self-referrals, for instance based on Google Ads for a particular disease. Some destination programs endeavor to market to their colleagues at regional or a national level. Most programs market to patients with conditions that have high financial margins, or perhaps patients that have insurance that reimburses favorably. Most destination programs are looking for a combination of factors: self-referred or physician-referred patients, often from a distance, that are highly profitable on the professional side or for the hospital or institution. Some larger metropolitan areas may also be in competition for surgeons to fill operating rooms and hospital beds, and therefore they may be marketing not to patients, but marketing to attract surgeons to their hospital. For now, I'll be talking about practical marketing strategies to acquire destination patients first. I will not talk about grander strategies or options that are very technology or capital intensive, such as building a telemedicine program or acquiring practices, hospitals, or insured populations. Instead, I'll be talking about more practical steps that most institutions or practice can begin now, and I'll show you how MeAndMyDocs software can be integrated into these strategies. Specifically, I'll talk about how MeAndMyDocs can be integrated into a program of direct marketing to patients at a regional or national level, or, for that matter, to build an international destination program. I'll describe how our software can help develop and sustain the critical referring physician relationships for destination programs. And finally, I'll describe how hospitals and health systems can use MeAndMyDocs.com as a tool to attract surgeons to your operating rooms and to fill your hospital beds. First, an overview of MeAndMyDocs.com. We're a HIPAA-compliant, fast, and easy system for obtaining, reviewing, and archiving patient radiology images. How does it work? With a few clicks, imaging studies can be securely uploaded from any location by any authorized person well ahead of a medical appointment. We use an invitation system. The physician or her staff can then review the imaging studies and schedule more studies if necessary. Thirdly, with one click, the most critical studies can be sent to your electronic health record. And if a patient comes with a CD, staff can use the same system to send the studies to your electronic health record. How can MeAndMyDocs.com help you build destination programs? MeAndMyDocs.com software is paired with direct marketing to regional or national patients, or for that matter can be used to attract international patients. The software can also be used to build sustaining referring physician relationships, which I'll describe in a moment. Of course, to acquire destination patients, either national or international patients, you must first have a destination quality program and for supporting infrastructure. You have already worked hard to build the program and attract the attention of patients or other referring physicians, but in addition, it is expected that you have an infrastructure of customer-friendly systems and procedures to facilitate patients coming with complex problems from distant locations. The ability to gather complex medical data before a patient travels to a destination program is one of the core elements of a patient-friendly destination program, but it's not easy. Paper records, test results, and pathology reports can be cumbersome to gather, but acquiring a patient's medical images in advance of their appointment is even worse. Typically, it's slow, cumbersome, and expensive, usually requiring FedEx expenses in several days' time. Then, managing the CD-ROMs and sharing the data with busy clinicians or clinical teams is another logistical barrier to timely appointment planning. MeAndMyDocs application can solve the problem of acquiring and managing medical images. Again, with MeAndMyDocs, it's just 3 steps. Invite the patients or referring doctors to securely upload the images. Have one or more team members review the images online, and then simply click the images to send them to your electronic health record. Imaging can then be collected in hours, not days or weeks. Additional studies can be coordinated at your institution, if necessary, prior to the office evaluation. In the consultation room, you have all the data to allow one-touch care, to make the decisions for treatment at the first visit, saving the patient's time, money, and angst. Patients and referring doctors that have used MeAndMyDocs are impressed how the system expedites patient care and are extremely satisfied that their data is available for review before their appointment. Building a sustainable destination program means satisfying your referring doctors as well. MeAndMyDocs makes it easy to refer patients and manage their images. It allows referring clinicians to confer with your destination program physicians, to review and discuss imaging studies together online, and most importantly, it allows you to take good care of their patients. We find that referring physicians expect this collaborative relationship. They want to make it easy to refer patients. They want the destination programs to value their role and talk to them, consult with them, and of course take good care of their patients. Finally, for those CEOs or hospital administrators who practice in a region where you have independent practices that admit to your hospital, MeAndMyDocs software can be used to attract surgeons and other specialists to your operating rooms and fill hospital beds. How? Surgical practices are very imaging dependent, and as a surgeon, I can assure you that CD-ROMs are a huge problem. If you support your local surgical practices using MeAndMyDocscom software, the software can be configured to allow surgeons to transmit preoperative imaging studies to your radiology information system, where the imaging studies will be available for their operative cases in your operating rooms. If you make it easy to operate at your institution, surgeons are more likely to come. Please contact us to see how MeAndMyDocs can help you improve your ability to provide your services to patients, help you attract destination program patients, help you impress your patients and referring physicians, strengthen your referring physician relationships, and perhaps attract surgeons to your operating room or hospital. Please feel free to contact us at sales@MeAndMyDocs.com, or I'd be happy to be contacted at my email address as well. Thank you very much.